Do you know what a dry drunk is? This term might seem confusing, but it's a critical concept in understanding addiction and recovery. Essentially, a dry drunk is someone who has stopped drinking alcohol but still displays the same behaviors and attitudes that led to their addiction in the first place. It's like they've removed the alcohol from the equation, but the underlying problems remain. Think about it this way. Imagine you have a leaky roof and every time it rains, your house gets flooded. You decide to stop the rain, but the roof is still leaking. That's what being a dry drunk is like. You've stopped the rain of alcohol, but the leaky roof of destructive behaviors and attitudes is still there. The takeaway here is that being a dry drunk isn't about the absence of alcohol, it's about the persistence of unaddressed issues. So, dry drunk syndrome is not about the alcohol, but the unaddressed issues that fueled the addiction. But how do you recognize a dry drunk? What are the symptoms? Well, let's dive right into that. The signs of dry drunk syndrome can often be subtle, but they're nonetheless significant. One of the most common symptoms is a noticeable shift in mood. The individual may swing rapidly from elation to despair and back again. Another common symptom is resentment towards others, particularly those who are able to drink without experiencing problems. This resentment can be coupled with jealousy of those who drink, as the individual may long for their own past drinking days. In addition, there's a tendency to romanticize their drinking days, seeing them through rose-colored glasses, if you will. This can lead to a yearning to return to those times, despite the negative consequences they experienced. Furthermore, there's often a tendency towards impulsive behavior. This impulsivity can be emotionally draining for the individual and can lead to strained relationships with loved ones. Recognizing these symptoms can be the key to understanding and helping a dry drunk. So we've talked about what a dry drunk is and the symptoms they may exhibit, but what can we do about it? It's paramount to realize that addressing these symptoms is not just about surface-level changes, it's about digging deeper, understanding the root cause, and then building from there. Seeking professional help is crucial. Therapists and counselors are trained to understand the complexities of addiction. They can guide the individual through the maze of emotions and help them find their way back to a healthy mental state. In addition, engaging in therapy can be a potent tool for self-discovery and growth. It's not just about talking, it's about learning new ways to cope, to react, and to live. Finding healthy coping mechanisms is another essential step. This could be anything from painting to jogging or even cooking. It's all about finding something that brings joy and tranquility. Remember, understanding is the first step to recovery, so let's strive to understand, to help, and to heal.